Liposuction is my favorite operation. It was invented around the same time I started as a plastic surgeon, so I've truly seen its entire evolution and progress during my career. I find it to be the most three-dimensional, sculptural, and challenging procedure that I do. The concept is simple. A hollow tube with holes in it is introduced into the fat that lies below the skin. Suction is applied and the fat is removed. But the reality is much more complex. Different areas of the body have different kinds and textures of fat. There are areas where the skin is much more adherent and needs to be considered. The skin varies in thickness in different parts of the body and will respond differently to liposuction. Plus, gravity and aging need to be taken into consideration. Fat is a way for the body to store extra calories. When we eat too much, the calories that we don't burn up are stored in fat cells. The body has a certain number of fat cells that stay constant throughout your life in number and location. When we gain weight, all the fat cells increase in size, and when we lose weight, they decrease. This happens in every fat cell, and you can't target certain areas. Problem areas are just areas where there are too many fat cells. Fat cells don't naturally go away and just change in size, so you're always a bigger or smaller version of yourself. Liposuction is not a weight loss procedure, although fat is physically removed and you will lose some weight. Liposuction is designed to make your figure better by removing problem areas. Literally, everyone, no matter how slim, has a problem area of their body where they think there's relatively too much fat. Liposuction can solve this problem. In liposuction, fat cells are taken away surgically from problem areas that have relatively too many fat cells and improves your proportions permanently. Just like fat cells don't go away by themselves, they don't ever multiply by themselves, so a change made by removing fat will be permanent. You will still gain and lose weight on the scale as you did before, but your proportions will be forever improved. The most common areas treated are the abdomen, hips, thighs, arms, chest, back, neck, and knees. When liposuction was first introduced, there were significant limitations on the amount of fat that could be removed. The first advance in liposuction decreased bleeding and improved the safety and amount of fat that could be removed. This was called the tumescence technique. In this technique, fluid is injected into the fat layer before liposuction to make removal easier. I use tumescence in all of my liposuction, and there is minimal bleeding. Other advances have been ultrasound-assisted, laser-assisted, smart lipo, as well as power-assisted liposuction. I currently use all of these modalities, but choose the area to use them in. Different areas of the body are easier and better treated with these newer devices, but the type of liposuction is much less important to the final result than the experience of the surgeon. Recovery from liposuction is rapid. Depending on how many areas are treated and how much fat is removed, recovery is usually a matter of days and rarely 1 week. In some patients who only want 1 or 2 areas treated, the procedure may be done under local anesthesia with essentially no recovery time. This minimal downtime can be compared to non-surgical fat removal with better results and actual removal of fat cells. Newer, so-called non-surgical approaches to fat removal like fat freezing, external ultrasound, and radiofrequency do not remove fat cells, do not give the same results as liposuction, and are not as predictable. And they're very limited in the amount of fat that they can remove. For these reasons, I don't use these procedures in my practice. I'm confident that I can treat a problem area with liposuction with minimal downtime and excellent results.